Hi, my name is Megan. I'm going to be going through my CAP PowerPoint presentation on women's soccer injuries, specifically with collegiate women's soccer players, ages ranging from about 18 to 23 or so. So there's going to be three injuries that we're going to be going through. So that's going to be concussion, inversion ankle sprain, and hamstring strain. There are so many other injuries that can occur, especially with women's soccer players, but these tend to be the most common seen every day. And there are different environmental factors that can play into it, such as the climate, since it is an outdoor sport. It can be very hot, cold, rainy, snowy, humid. That can play into a lot of different injuries, as well as the conditions they're playing on. So whether the grass is real or if it isn't real, and if it is real, is it maintained? Is it cut? Or are there holes in the ground that girls can get their ankles caught in? Or especially with turf, there tends to be a couple more injuries with the turf, especially called turf burn. So if they fall and get an abrasion on the turf, then um, that would be a bad injury. So we'll start with concussion. So concussion is a type of mild traumatic brain injury that can result in unconsciousness, disorientation, or amnesia. It doesn't always result in unconsciousness, but if it does, you definitely want to look for more warning signs. So the mechanisms can be a couple different things. It can either be a face-to-ball contact, like in the picture, or it can be a girl-to-girl contact, or even falling, standing up and hitting the ground or hitting a goalpost. There's different ways that this can happen, and it can either be a injury at the point of contact, a cope injury, or the opposite side, a counter cope injury. And what actually happens with the brain is an acceleration or deceleration in rotational force inside, which causes a shaking of the brain inside the skull cavity, which is how a concussion occurs. So for the assessment, it's really important to really make sure that you figure out that it is a concussion and then take the appropriate steps from there, such as a BESS or eye function test or a SCAT-5 test to really see the baseline of where the athlete or the patient is at and then go from there. According to the different signs and symptoms, you want to record the behavior changes or any clinical symptoms such as physical signs or sleep disturbances. So you could even ask the athlete's roommate if they could keep an eye on them and, show if they've changed at all for worse or for better, someone who really knows them that can monitor their signs and symptoms. So treatment is a little tricky. There isn't like a set treatment unless, it's really bad and they have to go get a CT scan or an MRI scan and go through that as far as the hospital. But as far as athletic training, it's really just, making sure you go through the protocols. You're doing immediate testing that can be done through the SCAT-5 test and, giving them the appropriate rest time that they need before they go back into the game. So some preventative and rehabilitative exercises. Again, it's going to be hard to do for a concussion. There isn't really any exercises you can do to help. But when they're going through the stages, it's important to start on a stationary cycle bike like we have up here, and then progress into different types of things like sit-ups and push-ups and even burpees to see how their brain functions and moves inside their skull and if it makes it worse or not. Some preventative things are really going to come from the coach's side. So you can have the coaches help the athletes and progress them into different drills onto how to properly head the ball so that we're not having head ball concussion type injuries, and players can even purchase specific headgear to help prevent concussions during the game. The next injury that we're going to talk about is the inversion ankle sprain, which is the most common injury on the lateral aspect of the foot, which is injuries to the ligaments on the lateral side if it's inverted too much with the foot-ankle complex. So the mechanism could be a player coming down forcefully on the ankle after jumping or stepping in a hole on the field. If you've played soccer and done it, you probably got your foot stuck in a hole, especially when you were younger, and that's not fun. It can even come from the picture of getting slide tackled or getting a cleat right into the side of that foot right there. So as far as the anatomy goes, inversion ankle sprains cause injury to the lateral ligaments of the ankle and can include the calcaneofibular ligament along with anterior and or the posterior talofibular ligament. Complete rupture is going to be the worst with the anterior talofibular ligament, which allows rotary ankle instability. So a portion of the bone could even be avulsed off from the malleolus with enough force and rip it off, and then you have a fracture with it. So that would not be good. Some tenderness and pain is going to be felt along with some of the hematoma and bruising that you saw kind of in the picture before this. And some assessments you can do are a talar tilt test, an anterior jaw test, and a medial subtalar glide test. So the treatment is really, rice is going to be important for about 30 to 60 minutes every 2 hours for 1-2 days for grades 1 through 3 sprains. And also an application of a horseshoe pad right over that lateral malleolus for compression with a wrap is going to help with the edema or swelling that they might have. And also limiting any weight-bearing activities, especially if it's a grade 3 sprain. You want to make sure that's going to heal right. So for the rehab on this, you can put them on a wobble board sitting down so they don't have too much weight bearing on it, as well as straight ahead short step walking, especially if it's going to be like a grade 2 or 3 sprain. You really want to make sure that they're able to get up and have that balance and be able to walk on their own on those ligaments and muscles. And you can also use resisted ankle dorsiflexion, plantar flexion, inversion, and eversion with that TheraBand and progress into ankle weights as tolerated. For preventative, it would help to integrate these workouts on the field in their warm-up with single leg stands with a partner, testing their stability, and then progress up into a single leg balance on the Bosu ball. And then we can also do the single leg resistant band kicks in flexion and extension, and hopefully progress into single leg standing with a cable band kicks. So our last injury is going to be the hamstring strain, which can be a strain or a tear to the tendons or large muscles of the hamstring complex. It's like the ankle can be graded on a 1 to 3 grade sprain. So the mechanism can be in soccer, specifically like a quick cut or a quick change of motion, or maybe the athlete didn't warm up proper enough and they just go straight into that sprint, and their hamstring complex and even their quads aren't fully prepared for that type of movement. So, there can be a strain or even a tear. So hamstring strains can include the muscle belly or even the bony attachment. It varies from a pulling apart of a few muscle fibers to a complete rupture or an avulsion fracture. The anatomy of it includes that complex that we're talking about, the semitendinosus, membranosus, biceps femoris, femur, the capillaries, and even your tib and fib if there's a fracture or if it's really bad. So for the assessment, it can go through the grades to see what kind of grade it is. So a grade 1 is going to be described as muscle soreness with movement and point tenderness. Fewer than 20% fibers are torn. With a grade 2, there's going to show partial tearing of the muscle fibers with shown as a sudden snap that the athlete's going to describe, or a tear with severe pain and loss of function with that knee flexion. The grade 3 is going to show significant edema, swelling, hemorrhage, tenderness, loss of function, especially during that knee flexion, and maybe even a mass that you can feel or a gap in between that muscle where you can see where it's torn. Special tests you can do for this are beginning in extension, the knees passively flex to check for range of motion and pain. Movement from flexion to extension that's strong and painful might be a strain, whereas if it's weak and pain-free, it might indicate a grade 3 strain or partial rupture. So treatment for this, ultrasound is going to be a good tool, which stimulates the repair of soft tissue injuries and relieves pain. It's mostly used to elevate the tissue temperature and is on direct skin with a coupling medium, such as a gel that you would use. Also, NSAIDs will be really good to reduce inflammation and pain management. So as far as rehab, you want just like concussion, the stationary cycle is going to be really good to stretch out all those muscles and the quadriceps and hamstring complex for about 15 minutes once a day, as well as forward lunges with no weight, and then decompress up progress up into having weights. And as far as prevention, again, on the field with like the ankle exercises, you can have hamstring flexion with light weight and then progress into that hamstring forward lean with a partner, going as slow as you possibly can to stretch out all those muscles and really strengthen them. And then from there, you can also do single leg squats and progress into the same squats even with dumbbells on the sides to really make it a lot harder. And then attached, I have my YouTube URL going through all those exercises with you, showing you how to do them, and then there are references. Thanks for watching.